Hi, and welcome viewers of Nursing Academy 101. In this video, we'll talk about Nursing Pediatric Multiple Choice Questions and Answers Part 2. But before we start, please don't forget to subscribe, like, and share the channel to encourage us to continue and provide you with all news. Question number 1. Louis, a neonate who is being readmitted for a cardiac anomaly. A thorough interview of the parent is critical during a cardiac assessment. We want to ensure that the health history interview time is used effectively and prepare a list of questions to ask the parents that would provide important information about the child's cardiac status. Which of the following symptoms is typically the first indication of a congenital heart disorder in an infant? A. Cyanosis. B. Decreased pulse. C. Congestive heart failure. D. Heart murmur. The answer is D. Heart murmur. Question number 2. Which of the following findings should be reported to the primary care provider? A. Blood pressure 80 over 55. B. Pulse rate 100 beat per minute. C. Respiration 34. D. Temperature 38.5. The answer is D. Temperature 38.5 degrees centigrade. Question number 3. Which of the following findings is not typically found in a child with pulmonary venous congestion? A. Resting bradycardia. B. Impaired weight gain. C. Circummoral cyanosis associated with feeding. D. Adventitious breath sound. The answer is A. Resting bradycardia. Question number 4. A newborn is diagnosed with a congenital heart defect. The test results reveal that the lumen of the duct between the aorta and pulmonary artery remains open. This defect is known as A. Patent ductus arteriosus or PDA. B. Ventricular septal defect VSD. C. Right ventricular hypertrophy. D. Pulmonic stenosis PS. The answer is A. Patent ductus arteriosus or PDA. Question number 5. A 10-year-old child is recovering from a severe sore throat. The parent states that the child complains of chest pain. The nurse observed that the child has swollen joints, nodules on the fingers, and a rash on the chest. The likely cause is A. Rheumatic fever or RF. B. Ventricular septal defect VSD. C. Right ventricular hypertrophy. D. Pulmonic stenosis PS. The answer is A. Rheumatic fever or RF. Question number 6. Indomethacin may be given to close which congenital heart defect in a newborn? A. Patent ductus arteriosus or PDA. B. Ventricular septal defect VSD. C. Right ventricular hypertrophy. D. Pulmonic stenosis PS. The answer is A. Patent ductus arteriosus or PDA. Question number 7. For the child with hypoplastic left heart syndrome, which drug may be given to allow the patent ductus arteriosus (PDA) to remain open until surgery? A. Prostaglandin E. B. Histamine, C. Adrenaline, D. Morphine. The answer is A. Prostaglandin A. Question number 8. During a well child checkup for an infant with tetralogy of Fallot (TOF), the child develops severe respiratory distress and becomes cyanotic. The nurse's first action should be to A. Lay the child flat to promote homeostasis. B. Lay the child flat with legs elevated to increase blood flow to the heart. C. Set the child on the parent's lap with legs dangling to promote venous pooling. D. Hold the child in knee-chest position to decrease venous blood return. The answer is D. Hold the child in knee-chest position to decrease venous blood return. Question number 9. While looking through the chart of an infant with a congenital heart defect of decreased pulmonary blood flow, the nurse would expect which laboratory findings? A. Decreased platelet count. B. Polycythemia. D. Decreased ferritin level. D. Shift to the left. The answer is B. Polycythemia. Question number 10. What should the nurse assess prior to administering digoxin? A. Sclera. B. Apical pulse rate. C. Cough. D. Liver function test. The answer is B. Apical pulse rate. Question number 11. Which statement by a parent of an infant with congenital heart failure who is being sent home on digoxin indicates the need for further education? A. I will give the medication at regular 12-hour intervals. B. If he vomits, I will not give a make-up dose. C. If I miss a dose, I will not give an extra dose. D. I will mix the digoxin in some formula to make it taste better. The answer is D. I will mix the digoxin in some formula to make it taste better. Question number 12. A child diagnosed with congestive heart failure is receiving maintenance doses of digoxin and furosemide. She is rubbing her eyes when she is looking at the lights in the room, and her heart rate is 70 beats per minute. The nurse expects which laboratory findings? A. Hypokalemia. B. Hypomagnesemia. C. Hypocalcemia. D. Hypophosphatemia. The answer is A. Hypokalemia. Question number 13. In which congenital heart defect would the nurse need to take upper and lower extremity blood pressures? A. Transposition of the great vessels. B. Aortic stenosis (AS). C. Correctations of the aorta (COA). D. Tetralogy of Fallot (TOF). The answer is C. Correctation of the aorta. Question number 14. A nursing action that promotes ideal nutrition in an infant with congestive heart failure is A. Feeding formula that is supplemented with additional calories. B. Allowing the infant to nurse at each breast for 20 minutes. C. Providing large feeding every 5 hours. D. Using firm nipples with a small opening to slow feedings. The answer is A. Feeding formula that is supplemented with additional calories. Question number 15. During play, a toddler with a history of tetralogy of Fallot TOF might assume which position? A. Sitting, B. Supine, C. Squatting, D. Standing. The answer is C. Squatting. Question number 16. A child had a tonsillectomy 6 days ago and was seen in the emergency room 4 hours ago due to post-operative hemorrhage. The parent noted that her child was swallowing a lot and finally began vomiting large amounts of blood. The child's vital signs are as following: temperature 99.5 Fahrenheit, 37.5 degrees centigrade, heart rate 124, blood pressure 84/48, and respiratory rate 26. The nurse noted that this child is at risk for which type of renal failure? A. Chronic renal failure due to advanced disease process. B. Prerenal failure due to dehydration. C. Primary kidney damage due to a lack of urine flowing through the system. D. Postrenal failure due to hypotensive state. The answer is B. Prerenal failure due to dehydration. Question number 17. The nurse is caring for a young child with pre-acute renal failure. Which of the following is the most common cause for this type of acute renal failure? A. Wilms tumor. B. Heart failure. C. Vesicular reflux. D. Contrast media diagnostics. The answer is B. Heart failure. Question number 18. The parents of a 7-year-old tell the nurse they don't understand the difference between chronic renal failure and acute renal failure. Which is the nurse's best response? A. There really is not much difference between the terms are used interchangeably. B. Most children experience acute renal failure. It's highly unusual for a child to experience chronic renal failure. C. Chronic renal failure tends to occur suddenly and is irreversible. D. Acute renal failure is often reversible, whereas chronic renal failure results in permanent deterioration of kidney function. The answer is D. Acute renal failure is often reversible, whereas chronic renal failure results in permanent deterioration of kidney failure function. Question number 19. Chronic hypertension in the child who has chronic renal failure is due to which of the following? A. Retention of sodium and water. B. Obstruction of the urinary system. C. Accumulation of waste products in the body. D. Generalized metabolic alkalosis. The answer is A. Retention of sodium and water. Question number 20. The diet for a child with chronic renal failure should be high in caloric and include A. Low protein and all minerals and electrolytes. B. Low protein and minerals. C. High protein and calcium and low potassium and phosphorus. D. High protein, phosphorus and calcium and low potassium and sodium. The answer is C. High protein and calcium and low potassium and phosphorus.